I would say in the past 5 to 10 years, we've seen a lot of advances in minimally invasive surgery, as well as recently we've been seeing more advances in robotics and navigation. And that really allows us to do what we need to do surgically with minimal soft tissue disruption and less pain afterwards. So we've done some studies here looking at opioid use. We're very concerned about opioid use, making sure we're not contributing to the opioid epidemic, helping patients and being cognizant of that. So we looked at a lot of factors around surgery to see if we can minimize opioid use in the long term. And we saw that there was a difference between traditional open surgery and minimally invasive surgery in terms of prolonged opioid use in the long run at 6 months. So I think that's really sort of key, showing that patients do well after surgery. They get back to their activities faster. They're in the hospital a shorter period of time. And overall, whenever I can apply minimally invasive techniques, I do, because I really believe that it helps the patient. So the use of stem cells in degenerative disc disease is a really exciting concept. We haven't seen a lot of good outcomes yet. And that's because back pain is multifactorial. So you're looking at one part of a bigger picture. So maybe you can help one part, but then, so if you can help the disc pain, then you still have facet joint pain, you still have paraspinal muscle pain, you still have stenosis or nerve pain. So it's a area of interest to a lot of people, which I think is good. And if we can help decrease pain that way, that would be great. I haven't seen a lot of stuff that is conclusive and would warrant me adding that to my practice or offering that to patients. So as with most things in medicine, what drives the advance and the staying power of an advance or technology or anything is the benefit to the patient. So if you really see a benefit to the patient, then most people get on board really quickly. Additionally, there are other benefits such as being able to having more technology that helps ramp up the adaptation or the implementation of these techniques in your OR. But overall, it's just, if you see patients do better, you're going to want to continue to do that. Around that, we've seen instrumentation companies come up with systems that are easier to use in a minimally invasive fashion. We've seen the advancement of navigation and robotics, and as well as sort of administrative support around these surgeries. So I think everything is sort of coming together in the perfect storm to really push this to the forefront and make it more mainstream. I would say it's fairly mainstream at this point, and in the future it will probably be more gold standard. There's some stat about the first lap chole was done in France in, I believe, 1987, and within 3 years, every lap chole in the US was done, or every cholecystectomy was done laparoscopic. And we're just a little bit slower to adapt the technology because we kind of need, or the minimally invasive technique, because we needed some technology to really apply that to spine. But once we got that, we saw a rapid switch in surgical technique, just like the cholecystectomy.